Hi children, good morning. This is a social science class. Today, let us see about lesson number 2, Politics, Healthcare Services in India. First, we need to know about health. Health, it is very important when compared to any other thing in the world, isn't it? Without health, if you have wealth, that wealth is nothing. So, let us see about the healthcare services in India. In a democratic country, the government that is responsible for the well-being of the people, children. Government, it is responsible for developing healthcare services, implementing healthcare services and monitoring healthcare services. Okay, it needs to provide so many programs for improving the health of the people of the nation. Good health has some factors, children. What are they? Yes, the first one is access to clean drinking service. Second one is pollution-free environment. Third one, adequate nutrition. Fourth one, hygienic living. Fifth one, active, stress-free life. We should not get tensed for any unwanted thing, children. If you get tensed, automatically our health condition will be low. Okay, then healthcare services like hospitals, laboratories, blood banks, along with some equipments, medicines, qualified doctors and nurses. Okay, these are also some important factors to treat all kind of people in our country. Let us see about healthcare in India in page number 220, children. Here they have given the first point. What about the first point? Yes, in the first point, they had said that India has the largest number of medical institutions in the world. Okay, here 50,000 medical experts pass out every year. Then, from the year 1950 onwards, increase in the number of healthcare facilities. There were so many improvement in the healthcare facilities, especially hospitals. Okay, from 2,717 hospitals in 1950, it has grown as 18,218 hospitals in the year of 2000. Then the third point, people from other countries, they come to India to get better treatment. So when compared to other countries, here we have better hospital facilities. Then the fourth point, India is the fourth largest manufacturer and exporter of medicines in the world. Okay, and the fifth point, half the children in India do not get sufficient food and suffer from malnutrition. We know that because when compared to other countries, India has large number of poor people. Though India is an agricultural country, in this country only half of the children do not get proper food and nutrition. Okay, then the sixth point, India's population do not have access to clean drinking water. Here in Salem, we are getting better drinking water. That is not a problem. But in other places, they are not getting proper drinking water. 21% of all infectious diseases are waterborne diseases. Diseases like diarrhea, jaundice, hepatitis, cholera, all these things were spread due to which one? Due to water. 5 million people died after independence due to tuberculosis every year, children. And then 2 million cases of malaria are reported every year. When compared to urban areas, children, the rural areas, those people in rural areas, they are not getting proper medical facilities. Okay, so rural Indian people still they have to travel a long distance to consult doctor, children. Our Indian government and state government, they have taken lot efforts to fulfill the needs of rural people, but the efforts taken by the government are not enough to fulfill the needs of the rural people. Next, let us see about public health services in page number 222, dears. Public health services, it is the backbone of healthcare services in India. Okay, here the government are running hospitals. Government are running hospitals as well as dispensaries, as well as in urban areas and in rural areas. Okay, so here the government, it provides free treatment for all the people. Okay, and in some places to take ECG or else to take CT scan, we need to pay a little when compared to private hospitals. Small health centers with a trained nurse and a village health worker, they have to work under primary health center, that is PHC. The doctors who are working at PHCs, they oversee the work of many villages. Then at the district level, district hospitals are there, we know the twin. Okay, if we need to test anything, we need to test in this district hospitals only. The testing facilities are in district hospitals and higher treatments also available there. And in cities, there are so many government hospitals. Along with the government hospitals, the government organizes so many health camps to spread awareness about diseases like polio, hepatitis, and then malaria, chikungunya, jaundice, and tuberculosis. Government organizes certain camps on Sundays, okay, to create awareness on these diseases, especially the polio days they assign on Sundays. Children who are below 5, they have to vaccinated against polio, isn't it? As per our constitution, the government not only ensure the well-being of the people, it should give essential healthcare services too. Let us see about private health services in page number 223. Beside the public health services in urban areas, there are so many private clinics, hospitals, isn't it? And so many medicals are there. In rural areas, there are some registered medical practitioners. Those are RMPs. These people treat people in the villages. Okay. In cities, there are so many hospitals nowadays. Those hospitals are act as corporates. Those hospitals are corporate hospitals because they have so many laboratories. Okay, and then they are having so many medical shops. Those hospitals are very expensive and it is not reachable for the poor people. Next, let us see about healthcare and equality. We know in last few years, that means in last few decades means we know that is 10 years. So in the last few decades, we have seen so many remarkable growth in private health service. Already we have seen that private health services are corporate nowadays, isn't it? Everything is very expensive in private healthcare. Poor people, they are unable to afford those medicines and treatment. Rich people, there is no matter, they can take everything from the corporate hospitals. But the poor people nowadays, they also need the treatment from the private hospitals, isn't it? But they are unable to afford everything like the rich people. So the government, it has to improve the quality of the government hospital. Then only poor people also can get treatment like rich people in corporate hospital. Our Indian government has taken some initiative steps to improve the health of the people. Okay, the main thing is National Rural Health Mission. That is, the next topic is women's health children. Here in India, the women's health is neglected in many parts of the country. Women also need to get proper medical facilities. In tribal areas, there are only few health centers only, but those health centers also not functioning properly. The rural area people, they feel more comfortable to visit village doctors. Okay, they are not feeling comfortable to visit qualified medical doctors. Let us see about the next topic, healthcare remedy. So, our Indian government, it has to take so many effective steps to improve the healthcare facility of the people. Okay, so our government, it has to concentrate on hygienic surrounding, pollution free environment and clean drinking water. We need to know about the Costa Rican approach. Costa Rica, it is a country in South America. The government of this Costa Rica, it dismantled its army. Okay, the money of the army they spent on the health of the people, education of the people, and the basic needs of the people. Okay, so that's why automatically the health, education, and basic services like drinking water, sanitation, nutrition, and housing, everything they improved. So today, South America, it is the one of the healthiest country in the world. And that's all for today's session, children. Today, what we have seen, yes, we have seen about healthcare in India. Then we saw about public health services, private health services, healthcare and equality, NHRM, healthcare remedy. Especially, we have seen about the Costa Rican approach. Okay, just take a book and read these 4 pages. Page number 220, 221, 222 to 23. Okay. Thank you, children. Be safe at home, dears.